Hi, my name is Ashley. I'm going to be your nurse today. I'm from Purdue University Northwest. Now, I did check into your chart. Your doctor did order a Foley catheter because you're experiencing some kind of urinary incontinence and it's causing you some discomfort. Before I begin though, can you tell me your name and date of birth?
Sam Kralik and 22301.
Perfect. Now, before I walked in, I did not see any PPE contact precaution sign outside, so I will not be gowning up in any kind of way. I did perform hand hygiene too. For this procedure, Sam, I have to make sure that I have adequate lighting, and I do. Now, do you have any allergies, such as iodine or latex?
No.
Any allergies at all?
Nope.
Okay. Are you experiencing any kind of pain right now?
No.
Okay. So before we begin, I'm going to adjust your bed so that you're comfortable, and then I'm going to make sure it's at elbow height. So I'm going to adjust the bed. All right, the bed is adjusted. Okay, Sam, I'm going to clean your genital area, but I'm going to uncover you and do some things prior to that, so bear with me. All right, going to remove your blanket here. There's this draping I'm going to place over your penis. Okay, like so. Now, do you have any questions for me, Sam, moving forward with your catheter?
No.
Okay. If you do at any time, just let me know. What I'm going to continue to do now, like I said, I'm going to bathe you, but I'm going to put this little pad under you, so I'm going to have you lift up your butt. Awesome, good job. You can put your butt down. Alrighty. I'm going to put on some gloves, get some wipes, and start cleaning your area. Okay, so first things first is that I'm going to clean the tip of the penis in a circular motion downward and also down the shaft to the pubic area. Okay, let me know if you're experiencing any kind of pain as I'm doing this, all right? Also readjusting my wipe here each time I move around different types of skin areas. Okay, almost done. You're doing really well. Alrighty, so I'm going to be using just one wipe. Everything looks good here. I'm going to have you have your skin dry. Alright, I want to remove my gloves and dispose of them. Next, I'm going to perform hand hygiene. Okay, next thing we're going to do, Sam, is that I'm going to prepare my supplies. The kit itself. I'm going to remove it from its packaging and dispose of any kind of garbage that I have. My surface is dry. I'm going to unfold the draping away from me first, both sides, and the final flap towards me. I'm going to take out my sterile gloves and put them on. Unfolding the top folds first and the bottoms and pinching outward, making sure I don't contaminate anything. Okay. Putting on the first glove now. Second one. Sliding my fingers in. All right, and adjusting as needed. Okay. Disposing of the wrapper. Next step is that I'm going to put two drapings next to your legs for my sterile field. I'm going to place the plastic side down. All right, here I come. Right next to you, okay? And the second one, same thing, plastic side down. All right, second one, here I come. I'm gonna lay it down just like that. Now I prepared my sterile field. Since that is in a secure place, I'm gonna bring all of my supplies over and lay it on top of it. Okay, here I come. All right. I'm going to begin preparing for the insertion now, Sam. Since you did tell me you were not allergic to anything, specifically iodine too, or latex, I'm going to put the iodine on my cotton balls. I'm going to tear off the packaging, soak my cotton balls, and disposing. I do not need my hydrogen peroxide. Disposing. I'm going to open my lubricating jelly. Okay, and disposing. Next thing I'm going to do is I'm going to make sure my balloon inflates properly in my catheter, and also before that removing its sleeve and lubricating the catheter itself before I actually sterilize you and insert it. Okay, so sterile is on sterile. I'm going to be careful removing the actual catheter from the packaging because it can be quite flimsy. So I'm going to do it in a slow way. Folding it too, making sure everything stays sterile. Okay. What I'm going to do now, dispose of this. Okay, lie my catheter down. I'm going to test, like I said, the balloon. Firmly secure it inside. See if my balloon inflates. All right, here we go. Okay, balloon is intact and it does inflate. I'm going to deflate it. And then secure it, my syringe still on. So it's going to stay on. Then I'm going to lubricate it. Okay, catheter is lubricated. Final thing now, Sam, is that I'm going to sterilize your genital area, okay? So I'm going to take my non-dominant hand and grip firmly on your penis. Grabbing my forceps. Now this is my dominant hand is sterile now. Still sterile. I'm going to take one cotton ball. Use circular motions once again toward the meatus, around the meatus, and on it. And making my way down. I'm going to do this another 2 more times. Firmly not letting go of the penis in my left hand. Okay. Making sure I cover with iodine, meatus, down the shaft. All right, 3rd cotton ball. Okay. You're almost done. You're doing very well. Are you experiencing any more pain?
Nope.
Okay, going to dispose of my forceps. Okay, now I'm going to insert the catheter. I'll let you know when I do so, okay? My catheter is already lubed. Okay, I'm going to tilt your penis at a perpendicular angle here just a little bit. All right, I'm going to go in. So prepare yourself. Bear down. Ready? 3, 2, 1. Here we go. You're doing really well, Sam. Okay, I'm going to continue to push until I start to see some urine flow. Okay, I see some urine. All right. What I'm going to do now is I'm going to inflate the balloon to make sure that it's secure inside his bladder. All right, here we go. Pressing down on my plunger, filling the balloon. Alrighty, almost there. Almost done. All right. Balloon is inflated. I'm going to release my syringe and then dispose of it. And then now I'm going to give it a slight tug to see if it's firmly in place and it doesn't fall out. Okay, it is firmly in place. Now, Sam, I'm going to hang up your bag and then that will be your procedure. Then I will be done, okay? Right below your bladder.